Today we'll be discussing the case of Phumeza Tisile. It's May 2010. Phumeza is on her way to her classes. A few months ago, she was as healthy as could be, but at this particular time, she was not feeling well. She was very fatigued, so bad she struggled to walk up the stairs to get to class. And not just this, but she was losing a lot of weight. She went to multiple doctors, she did various tests, but all of them sent her back home saying nothing was wrong. And as the weeks went on, her condition only worsened. Nobody had an idea what was wrong with her, and to doctors, this was all a medical mystery. That was, however, until one day she received a call with startling news she never would have ever expected to hear. Phumeza had tuberculosis. And what should have been just a few weeks of treatment quickly turned into months and then into years. Because what doctors initially didn't realize was that Phumeza didn't just have regular tuberculosis, but rather she had drug-resistant tuberculosis, the deadliest type of tuberculosis there is. She would be transferred from hospital to hospital just trying to get treatment that would work, but things were not looking good. Phumeza was left to make a very difficult decision, and what would happen next would leave all of the doctors absolutely stunned, highlighting some serious changes that need to be made towards the treatment of patients with drug-resistant tuberculosis. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. Alright, let's get into this case. Phumeza Tisile was born on September 5th, 1990 in Port Elizabeth, which is now known as Gqeberha in Eastern Cape, South Africa. She lived here up until she was about 6 years old, because it was around 1996 when she and her mother, who was a domestic worker at the time, moved to the township of Khayelitsha. This is a township just on the periphery of Cape Town in Western Cape, South Africa. Just to briefly explain, a township is historically a racially segregated area that was put in place as a result of a political system of segregation called apartheid. The apartheid was in place from 1948 until the early 1990s, and the townships specifically were used to house people who were not white, whereas people who were white lived in the cities. Khayelitsha is the largest and fastest growing township in Cape Town. At the time of the case, the official population of Khayelitsha was just a little under 400,000 people. However, it's stated that there's a quote, broad consensus that this is a serious underestimation and that the true figure is around 1 million. And some sources have even stated that it's currently home to an estimated 2.4 million people. And Khayelitsha is considered a densely populated and overcrowded area. Although when you look it up, there are many sources that emphasize high crime rate and violence in Khayelitsha, it still is highlighted by vibrant culture with many vendors, businesses, and activists. Her mother decided to make this move so that they could have better opportunities. Phumeza's aunt lived in Khayelitsha, so they stayed with her while her father actually stayed back in Port Elizabeth, aka Gqeberha, so that he could continue to work. Growing up, Phumeza was described as being a shy child who not only enjoyed going to school and learning, but also enjoyed being active through activities like running, drama, and even climbing mountains. In the beginning of 2010, when she was 19 years old, Phumeza started her first year as a student at the Cape Peninsula University of Technology in Cape Town. She was studying commerce, human resource management, and she was hoping to eventually get a job in the business and economics world. Khayelitsha is a place that is seriously affected by poverty, described as, quote, one of the most marginalized and poverty-stricken townships in South Africa. And because of this, Phumeza had goals to someday get a corporate job so that she would have the means to leave the township and live in a wealthier Cape Town suburb, such as one called Sea Point. She was enjoying her time at university. She was meeting new people, she was making friends, and as she approached the end of that first semester, she was looking forward to starting her second semester there. The second semester was scheduled to start sometime in June or July of 2010. But it was very suddenly when this dream was looking like it wouldn't be possible, because it was just before that when Phumeza began experiencing things that would change everything. Sometime around May of 2010, Phumeza began not feeling too well. She was feeling fatigued and she noticed that she was getting thin and losing a lot of weight. From the start of university, she would easily be able to walk up the stairs to get to her classes. But during that time in May, whenever she would walk up the steps, she was getting so tired and she couldn't do it. She was very concerned by this and was like, I need to go see a doctor. She ended up heading to a private clinic to see a doctor. They performed multiple blood tests on her, including checking for HIV, but each of these tests came back negative. The doctor wasn't sure at all what was wrong with Phumeza. She wasn't coughing, she didn't have night sweats or anything, and he was thinking she might possibly have pneumonia, but he wasn't sure, so he just decided to give Phumeza some cough syrup and a pain relief medication called Panadol to see if that would help. But ultimately, this didn't help, especially as she wasn't even in pain. He was a private doctor, so he wasn't able to test her for something like tuberculosis over there. And so he further told Phumeza that with this being a private clinic, she should instead go to a public clinic so that they could do more testing. Phumeza did just this. She went to a public clinic, and it was there where she did a sputum culture test, which is a test that uses a sample of one's sputum or phlegm from their lungs to test for any bacteria or other germs. After coughing out the sputum, they let her know they would be in contact when the results came back. But this wasn't any short wait. The township Phumeza lived in, Kailishta, is actually cited as being one of the highest places in the world affected by tuberculosis. Tuberculosis, also known in short as TB, is, quote, an infectious disease caused by bacteria that most often affects the lungs. It spreads through the air when people with TB cough, sneeze, or spit. TB is caused by the bacterium Mycobacterium tuberculosis. It's estimated that about a quarter of the world's population has been infected by TB, with about 5 to 10% actually experiencing symptoms and developing TB disease. There's two categories of TB that experts use to divide it. There's inactive or latent TB infection or active TB disease, meaning it's not always contagious. According to Medical News Today, an inactive infection will not cause any symptoms and will not transmit from person to person. A person with inactive or latent TB infection does not need to isolate. Active TB disease causes symptoms, may transmit to others, and may be fatal without treatment. TB is both preventable and curable, but it still is considered a public health crisis. TB is actually the world's top infectious killer, with 10 million people falling ill from TB every year and 1.5 million people passing away from TB each year. And while it is present all over the world, the majority of people who do fall ill from TB live in low and middle income countries. Even in wealthier countries, there's a higher prevalence of TB in the lower income areas. But still, nonetheless, it affects everywhere, with the 8 countries accounting for more than 2/3 of the global TB cases in 2023, from most to least most being India, Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, and the Democratic Republic of the Congo. At the time of this case, South Africa was on this top 8 list as well, and today it still remains a country with a high burden of TB. Considering Kailishta was one of the highest places in the world affected by it, it was important that they tested for this. Usually to test for TB, clinicians are able to use a rapid TB diagnostic test such as a gene expert machine. However, at the time of this case in 2010, these machines weren't available in South Africa. Sputum culture tests can take anywhere from a few days to a few weeks before the results can come back. And because of this, Phumeza actually waited for a whole 3 weeks before she got the results back. During those weeks, her condition just got worse. But get this, even with the worsening of her condition, the sputum came back negative for the infections they were testing for, including tuberculosis. As the days went on, it got to a point Phumeza was feeling so bad she wasn't able to walk properly. So she went to another doctor and told them like, hey, I'm not feeling well, I can barely walk, I don't know what's wrong. After looking at her, the doctor was like, okay, yeah, something is definitely wrong. You know what? I'm gonna have you take an x-ray of your chest and we'll see what we get from there. Phumeza did this chest x-ray and came back to the doctor with the scans. And after looking at the scans, the doctor was like, "Oh my goodness, this is looking really bad. This x-ray shows that you have tuberculosis." When Phumeza was told that she had TB, she was very confused. She'd heard about TB before, especially through stories from her uncles who were working on mines in Johannesburg, but nothing regarding people like her who were just a normal student going about their day. She stated, quote, "I'd heard about TB, but never in a million years did it occur to me that I would be a patient." Whenever she would come across posters or pamphlets outside of the clinic regarding TB, one of the main symptoms she would see presented in people who had it was a constant cough for about 3 weeks. She didn't have a cough. Not just this, but she was surprised because she didn't think that as a healthy person, she could be somebody who would get TB. In the clinic, she would see that the TB sign didn't just say TB, but it would instead say HIV/TB, which to her and many others made it seem like in order to get TB, you must have something like HIV, because with HIV, your immune system is weakened, which makes you more susceptible to contracting TB. Likewise, TB is actually the leading cause of fatality of people who have HIV, so there could be that association. Phumeza described, quote, "Not much is known about TB here. A lot of people attach the stigma of HIV to TB, but not everyone who has a form of TB is HIV positive. Till this day, there still is a lack of education and a lot of stigma surrounding TB. But anyone can catch tuberculosis, and it can be caught anywhere, especially in crowded areas with poor air circulation." She began reflecting on how she might have caught it, and she thought to herself, maybe it could have been on the bus. Every day, she would commute to her university classes on the bus, and in the morning, it was always full. So she thought this could have been a possibility, but also she knew it could have been caught anywhere. After she was diagnosed, they immediately started her on the regular TB drugs they give to patients to treat it. They prescribed her with 3 big tablets and some supplements to take at home. And for weeks, she diligently took these various different pills. The thing is, even after doing these medications for those few weeks, none of these were helping. She wasn't responding to the medications, and she was still feeling absolutely terrible. The doctor was very confused by this because typically the medications are supposed to clear things up. Because of this, they were like, "This is not normal. You know what? Let's do another sputum culture test and we'll hopefully see what's going on." They ended up doing this sputum culture test, and like before, Phumeza waited for 3 weeks to get the results back. It was once those results came back when she received a phone call. And when she answered, she was told that she needs to go back to the clinic as soon as possible. Initially, to her understanding at the time, there was only one type of TB, and the treatment for that should have taken just about 6 months of doing the medications. But it was at this appointment when they told Phumeza that she did not in fact have tuberculosis, but she instead had multi-drug resistant tuberculosis. And she was told that she would need to be on treatment for an additional 2 years for this. Multi-drug resistant TB is also known in short as MDR-TB, and it indicates that the TB was resistant to the medications that are used to treat regular tuberculosis. A doctor who'd go on to treat Phumeza later on explained that typically when somebody is showing TB symptoms, they go to a healthcare facility, they give their sputum sample, and then that gets sent for something called a smear microscopy. This is a quick and easy test that does show whether a person has TB or not. But with this, it doesn't specify if the TB is resistant to any drugs. To see if it's resistant to drugs, they have to do a drug resistance test. The thing about this test, though, is that it can be anywhere from a few weeks to a few months before they're able to get the results, because this would depend on how long it takes for the TB bacteria to grow in the culture. Not just this, but because of the high demand on resources, this isn't something that they do routinely for every patient with tuberculosis. They only do this test when the person's not responding to the regular treatment for TB. And what makes this more difficult is that the drug resistance testing occurs in 2 stages. The two most effective TB drugs that the doctor mentioned were the antibiotics, rifampicin and isoniazid. The first stage tests for resistance to these two drugs. If there appears to be no resistance, then they don't do any more testing because it indicates that they have regular tuberculosis. If there is resistance to both of these drugs, then the patient would be diagnosed with MDR-TB. But then if somebody reaches the second stage of testing, they assess whether there's resistance to a few other drugs. And in this case, this could reveal if the person has XDR-TB, which is extensively drug-resistant TB. They initially started Phumeza on regular TB treatment before they even did drug resistance testing. So once they received the results from the first stage of the testing much later on, it was only then when they discovered that the whole time she had drug resistant TB. And because she was doing regular TB treatment the whole time, she had gotten so sick by that point because the medications weren't effective against drug resistant TB. Phumeza didn't even have a second to process any of this information because it was very soon after her diagnosis when she was started on several different drugs. They briefly sent her to the Lizonabanda TB Care Center in Kailishta. This is a tuberculosis care center run by the Médecins Sans Frontières, known in short as the MSF. The MSF is also referred to in English as Doctors Without Borders, which is a, quote, global network of principled medical and other professionals working in small and large teams to respond to the medical needs of people affected by conflict, disasters, and epidemics, and those excluded from healthcare. When Phumeza first arrived at the Lizonabanda TB Care Center, she was feeling so bad she couldn't even remember anything from when she first got there, and she was feeling so weak she wasn't even able to talk. They brought her about 20 to 30 tablets and told her she needed to take them. Now, initially, Phumeza thought that this was just the supply of drugs she needed to take for the week, but they were actually like, oh no, like this is actually the amount you need to take right now. She swallowed these tablets and it took her a whole hour to get this done. But that wasn't all, because after taking these tablets, they came back up to her with a thick needle and they told her that she needed to take an injection as well. This was an injection of a drug called kanamycin, an antibiotic used to treat serious infections caused by bacteria. They injected Phumeza with this drug and immediately she was in pain. Because the thing about kanamycin is that many people describe this drug as being very painful. Phumeza described that you can feel the injection going down because of how painful it was. She stated how after taking it, she felt numb, and she further explained how some people even describe it feeling as if they were being injected by lava. But this wasn't all, because the doctor went on to tell Phumeza that not only was the treatment going to be 2 years, but she would have to take those 20 to 30 tablets every day for those 2 years, including that painful kanamycin injection every day for 6 months. She thought they couldn't be serious about her doing this injection every single day for half a year, but they were serious, and they finally told her that with how sick and weak she was going to need to be admitted into the hospital so that she could be properly monitored. They transferred her over to the Karl Bremer Hospital in Cape Town, and when she got there, her condition was very bad. She described, quote, "When I got to Karl Bremer, I am sure they thought that I was dead because I remember being in the dark room with no one else there, just me, alone, in the dark." She made sure to let the people she was close with know that she was diagnosed with MDR-TB and that she was admitted into the hospital. The thing is, many of the people in her life hadn't even heard of MDR-TB before. And so Phumeza, who also didn't know much about MDR-TB, just told them the little things the doctors were telling, and she used Google to find more information. She already didn't know how she caught TB, so she definitely didn't know how she caught MDR-TB. She didn't know anyone who's ever had it, nor did she even know that kind of TB existed. Throughout those next 3 weeks in June and July of 2010, Phumeza was doing treatment at this hospital, and even though this was already a lot, this was only the beginning of what was soon to be several years of very difficult treatment. They ended up transferring her over to the Brooklyn Chest Hospital in Cape Town to continue her treatment over there. When she got there, they told her she would stay there for just about a month. But after that month passed, she realized this was far from the case. The 20+ tablets she was taking daily made her feel absolutely sick. She described that there wasn't one day that went by where she didn't throw up. And this wasn't just an experience of her own, but she described that most, if not all patients, agreed that the medications were the worst part. Every morning, a nurse named Nurse Norkia would come around and shout pills to alert the patients when she was coming around with the medications. And Phumeza described, quote, "Those little things make you even sicker than you already are. There are times where one would swallow her vomit because you don't want to repeat taking the medication." For one of the medications she took, called Pauser, she'd actually have those pills crushed and mixed with yogurt so that the taste of the medication was less overwhelming. But it got to the point she got so sick of yogurt, she had to begin taking the pills with sour milk or custard. Additionally, she'd also have to take many supplements such as magnesium, potassium, vitamin B complex, and even vitamin B6, which alone ranged between 6 to 12 pills a day. And these would be taken in the morning and then repeated at night while taking the Pauser. As for the injections, because of how thick the needle was, she couldn't get it done in her arms. She either had to do it in her thigh or buttocks. And she described it got to the point where she got it injected so much, they were running out of new spots to inject it in. Despite the grueling treatment she was left to do, Phumeza was able to get used to her time in the Brooklyn Chest Hospital. She would see how hard the nurses were working, and she had a lot of respect for the efforts they would make despite the little resources they had. She described, quote, "Nurses don't get the respect they deserve. People say they are rude, but I could see how hard they were trying to do more with the few resources they have. I saw how when there were not enough TB meds, they would try to give us half. I saw how they had to break up the tablets and crush them for the kids with TB. There is no liquid form for younger children, so they have to take the same tablets as adults. You could just see how hard it was for them. People never talk about those things." After those many months, Phumeza was in routine and getting used to the environment. However, just 4 months into her treatment there, suddenly this all changed. In October of 2010, the month South Africa was actually hosting the FIFA World Cup, Phumeza was given a pass to go home for the weekend. She enjoyed getting passes to temporarily go home as it allowed her to be around her loved ones, eat the food she wanted, and just anything outside of the hospital. On that Sunday, just the last day of her break at home, she woke up and got herself ready to eat breakfast, take her morning meds, and start the day. Symptoms-wise, for the most part, this was a normal day. But there was one thing she couldn't help but notice. She had gone to the bathroom and ended up flushing the toilet, but as she did this, she couldn't hear the sound of the toilet flushing. Then she turned on the tap, but she couldn't hear the sound of the water running. Phumeza thought that this was really odd, so she walked over to the TV room and turned on the TV. But even after doing this, she couldn't hear the sound from the TV. She thought this was very strange, but she was like, you know what? Maybe my ears are blocked with wax. Let me see if I can try clearing them. She tried cleaning out her ears with an earbud, but even after doing this, she still wasn't able to hear a thing. She tried listening to music, but she couldn't hear that. Her mother tried speaking to her, and she still couldn't hear her. And by that point, she was extremely worried. The next morning, on Monday, she went back to the Brooklyn Chest Hospital, and when the nurse came to her room to get her pills, Phumeza told the nurse, like, "Hey, I can't hear a thing. Yesterday I couldn't hear, and I still can't hear today." As the nurse replied back to Phumeza, she could see her lips moving, but Phumeza cannot hear a thing. Right after this, the nurse left Phumeza's room, and very quickly after, she came back into the room with a pen and a paper, and she wrote down to Phumeza that she needs to head to the audiology department of the hospital to get her ears tested. Phumeza was accompanied by another person to the audiology department, and as they headed over there, this person was talking to her, but she still couldn't hear what they were saying. When they got there, the audiologist had Phumeza put on large headphones to complete a hearing test. And when she wasn't able to hear the sound from the test, the audiologist grabbed Phumeza's folder and wrote the word deaf in capitals. They told Phumeza that she was deaf. And after writing this to her, the audiologist explained in writing that he was sorry, but she has irreversible hearing loss and there was nothing they could do about it. Phumeza was so confused on how this could have even happened. But before she could even process this information, very soon after, she found out some even more troubling news. The audiologist told Phumeza that she should go speak to her doctor, and after she went up to her doctor and asked her how this could be, her doctor explained that this was actually a side effect of the kanamycin injection she was doing, and she further went on to explain to Phumeza that there was nothing they could do about it. Not once had anyone explained to Phumeza that a risk of kanamycin includes irreversible hearing loss. But this wasn't all, because right after this, her doctor told her that the results from her second stage of drug resistance testing came back. And she went on to inform her that not only had Phumeza lost her hearing, but she was also resistant to the MDR-TB drugs as well. This meant that Phumeza didn't have multi-drug resistant TB, but she instead had pre-extensively drug-resistant TB, also known in short as Pre-XDR TB. The difference between MDR-TB and Pre-XDR-TB are the types of medications that the TB is resistant to. MDR-TB is defined as resistance to the antibiotics isoniazid and rifampicin, whereas Pre-XDR-TB is defined as resistance also to rifampicin, but also to any fluoroquinolone antibiotic. Because of this, they ended up moving Phumeza from the ward she was in to instead be inside the pre-XDR ward of the hospital. In this ward, there were 4 other patients who were deaf from treatment, and this was somewhat of what she described as a, quote, weird relief, knowing she was not the only one. Listening to music on her phone and dancing was a way she would usually pass the time in the hospital, but now that she couldn't hear anymore, she deleted all of the music off of her phone, and she even gave away her headphones. Phumeza tried to convince herself that it wasn't that serious and that everything would be fine, but this was far from true. It was a big deal. She explained, quote, then it got scary. 2 of the patients took their own lives. The other one ran away from the hospital, and the other got discharged. Further explaining, quote, going deaf was a big deal, no matter how much I tried to convince myself that it wasn't. I have learned to live with it, but I will never get used to not hearing. It's not completely quiet in my head. I can hear the sound of a bus, truck, motorcycle, or very loud music. It is not natural, and it is actually very uncomfortable. The first day I went deaf, it sounded as if people were talking from a distance or were down a deep hole, but as time went by, their voices faded away. Phumeza initially thought that with this new diagnosis, her medications would also change, but she eventually found out that this was not the case, because the only medication they stopped was the kanamycin injection. As it wasn't working, it was really harmful on her kidneys, and this was the drug that caused her to lose her hearing. So with this, they instead replaced the kanamycin with a drug called capreomycin. As for the rest of the medications, she was still doing them. The only difference was now she was doing even more of them. Phumeza described when this all happened, quote, I was scared, but I did not give up hope. I thought the pre-XDR drugs were big and all, and not the same like the MDR drugs. Oh, they are the same, just that you need to take more. When Phumeza arrived at the pre-XDR ward, they did the normal check-in they do for new patients, including lab work and scans. But after the x-ray results came back, she was hit with some more concerning news because her doctor informed her that from her x-ray scans, it showed that there was actually something growing inside of her right lung. Now, they weren't sure what exactly it was, but her doctor told her that she believes it might either be a tumor or cancer. And with this, they immediately sent her over to the Groote Schuur hospital in Cape Town for her to get further evaluated there. Phumeza was extremely stressed out about this because it was already bad enough finding out she had pre-XDR TB. Now it just made everything worse having this cancer scare. They did some tests on her at Groote Schuur, and Phumeza just had to anxiously wait for them to come back with the results. After spending some time waiting for the results, the doctors at Groote Schuur came into her room, and it was then when they informed her that fortunately, she did not have cancer, nor did she have a tumor. She was extremely relieved to take this worry off her shoulders, but the doctors went on to inform her that instead of cancer or a tumor, she rather had fluid buildup from pus in her chest. They didn't explain how this happened or from what, but they let her know that in order to treat this, they needed to do a procedure to suck the fluid out of her lungs. Now, they went on to perform this operation, but it was in doing this operation when more complications occurred, because whilst doing it, they ended up accidentally breaking one of her ribs, and from this, her lung got punctured. One of her later doctors described this situation as not being uncommon for a procedure like this. This resulted in Phumeza developing something called pneumothorax, which in other words is a collapsed lung. And because of this, for 3 weeks, she had to walk around with a chest drain connected to her chest in order to reinflate her lung. After spending 3 weeks in the Groote Schuur hospital, she finally recovered and was sent back to the Brooklyn Chest Hospital. And fortunately, during this time, she was actually feeling, quote, even better than before. For the next 8 months, Phumeza passed her time reading and also watching soap operas that were the only TV shows with subtitles in South Africa at the time. Through all their evaluations and tests they did on her, everything was looking good. Phumeza was responding to the pre-XDR treatment, and it appeared that she was healing. They did some TB culture tests on her to see the status of the tuberculosis in her lungs, and the results of these cultures all came back negative, meaning no tuberculosis was found in the samples they tested. This was really good because it showed that the treatment was working. And with this, they approached Phumeza and they informed her that she would now be able to leave the hospital and go home to continue the treatment outpatient. Finally, after 11 months spent in the Brooklyn Chest Hospital, around June 2011, Phumeza was discharged. She described this saying, quote, I was so happy because I was finally out of prison. The plan going forward was for Phumeza to continue doing her treatment, taking medication outpatient at the nearest clinic, which is exactly what she did. She was taking her tablets diligently and was feeling much better, which was very exciting for her as she felt like the finish line was finally so close. But unfortunately, this enjoyment only lasted very briefly because it was very soon after being discharged when she was informed of some more concerning news. One day, Phumeza went to the clinic to do some regular lab work and tests. This was a normal routine for her: go to the clinic, do some tests, get medications, go home. But on this particular day, as she was in the waiting area, waiting for the results to come back, she couldn't help but notice that she was in the waiting area for much longer than usual. Finally, the doctor came to speak with Phumeza, and the news was very alarming. They wrote down on a piece of paper that the pre-XDR drugs that she was doing also were not effective, including that new injection she was doing of capreomycin, because it turns out Phumeza never had TB, she never had MDR-TB, nor did she have pre-XDR TB. The whole entire time, she had XDR TB, extensively drug-resistant tuberculosis, which is actually the most difficult type of TB to treat. Like discussed before, pre-XDR TB and XDR TB also differ based on the types of medications the TB is resistant to. The thing with this, however, is that XDR TB is resistant to the same drugs pre-XDR TB is resistant to, but XDR TB is resistant to more. So for pre-XDR TB, that's resistance to rifampicin and any fluoroquinolone, whereas for XDR TB, that too is resistance to both rifampicin and any fluoroquinolone, but it's also resistance to at least one of the antibiotics, bedaquiline or linezolid. As mentioned, drug resistant testing goes on in stages. They performed drug resistance tests on Phumeza, but it was only then when they had the news for her when the results from the second stage of testing were received. Her later doctor explained, quote, "Unfortunately, by this stage, she had been receiving partially ineffective treatment for a long time and had likely developed even further resistance to the existing TB drugs." With this diagnosis, they wrote to her that she not only needed a new treatment plan, but she would need to be readmitted back into the hospital. She described how she felt in this moment, saying, quote, "My hopes were crushed. This was a very difficult time for me." To her understanding at the time, she didn't know anyone who'd ever survived XDR TB, so she was extremely worried about this diagnosis. Phumeza was subsequently admitted back into the Lizo Nabanda TB Center in Khayelitsha, Western Cape, which is the first TB center she went to initially. Once she got there, she was approached by a woman who'd go on to play a huge role in Phumeza's treatment at the center, and her name was Dr. Jennifer, or Jenny Hughes. Dr. Jenny Hughes was the MDR-TB coordinator for the MSF in Khayelitsha. She did her medical training in the UK, graduating from Cardiff University in Wales in 2005. Just a few years later, around 2008, she moved to South Africa, where she worked in a rural area in Eastern Cape for about 2 years. And then in September of 2010, she moved to Western Cape to work with the MSF in Khayelitsha. With the MSF, Dr. Hughes worked as a medical officer to address the epidemic of drug-resistant tuberculosis in collaboration with the Department of Health and local stakeholders. In medical school, Dr. Hughes was only taught about 3 hours on tuberculosis, but even with this small amount they were taught, she was instantly interested and knew she wanted to work on tuberculosis. In Eastern Cape, she worked in a ward that only had women patients who had TB, and her passion truly developed there, where she witnessed such young women in their 20s and 30s who had their lives ahead of them, so sick and dying from a disease that is curable. She saw that such little care was put towards the treatment of these patients, and she wanted to make sure this changed. Dr. Hughes, who Phumeza would refer to as Dr. Jenny, would go on to play a tremendous role in supporting her during her treatment, just as she continued playing a major role in the early work to improve care for patients with tuberculosis worldwide. Dr. Hughes met with Phumeza while in the care center and explained to her that she had XDR-TB and truthfully told her that her chances of survival were low. She explained how at the time, only about 20% of patients with XDR-TB have been able to survive, further describing that this 20% was if they continued using the old drugs, which came with many toxic side effects. However, she went on to explain how there was this new drug that could potentially work called linezolid, which I've mentioned before. Linezolid was an antibiotic that was discovered in the late 90s, and it's used to treat various bacterial infections. Their plan was for Phumeza to be on a 17-tablet per day treatment regimen. This was going to include a combination of different drugs, most notably the linezolid and one called clofazimine. These were very expensive drugs, so they weren't routinely or easily accessible for patients in South Africa with TB. For example, at the time, one pill of linezolid cost 700 South African rand. This was just around $60 for one daily pill of the medication, which would be $420 for a weekly supply and $1,680 for a month's supply. This doesn't even include the other medications they were doing. Most patients aren't able to afford this. But fortunately for Phumeza, being how compliant she was with her treatment and her determination to get better, the MSF was able to cover the linezolid and the government was able to cover the other medications to continue her treatment. And this truthfully was the last option they had for Phumeza to be cured. Dr. Hughes described that while this might potentially work, there's just of course no guarantee. But she asked Phumeza if this would be something she wanted to try. This was a life or death situation, so Phumeza was willing to try whatever was suggested to treat this, and so she agreed to take this drug, stating, quote, "I didn't want to be a statistic, another person who died from TB." With this, she was officially the first patient to be enrolled in MSF's Strengthened Regimen program, a program that was piloted as part of an already well-established program called the Decentralized Drug-Resistant TB program that was running in Kailicha. Eventually, by 2013, 22 patients would be enrolled in the program. They placed Phumeza in the Lizo Nabanda hospice to get started on treatment. To keep her busy while doing this treatment, Phumeza actually blogged what she was going through on a collaborative blogging project created by the MSF called TB&ME, where MDR-TB patients were able to blog about their experiences. The amount of support Phumeza got from this blog was very touching to her. She was having people comment from across the world, encouraging her and writing her nice messages. And it was nice for her seeing how people from so far away could care about how she was doing. During those next few months, there were some highs, but there were a lot of lows. One of the side effects from the linezolid that Phumeza experienced was vomiting, but this wasn't all because very concerningly, one day, the treatment just stopped working. On Tuesday, October 11th, 2011, Phumeza posted a blog post titled "More Pain and More Suffering." Unfortunately, this post, along with a few others, haven't been archived, but in the preview of the post, she stated, quote, "Well, eating more than 20 tablets a day doesn't seem to be enough. Ho ho ho. Well, now apparently I'm getting 4 injections a day. Yes, 4. Not for long though. Just a couple of days, but it seems like it's taking forever. I'm doing what you'd call eating your best." 3 days later, on Friday, October 14th, she described the psychosocial struggles of being in the hospital with such a diagnosis in a blog titled "Being Isolated and Treated Like a Nobody, Especially in Hospitals." In the preview, she expressed her struggles, stating, quote, "People don't want to come near you or even chat to you when you are wearing that respirator mask. Well, from my point of view, I guess it's the little information they get about TB in general, and specifically where and when it is safe or not to come near a person who has TB." But despite the isolation, she did feel a sense of community with her fellow TB patients at the Lizo Nabanda TB Center, describing in a Monday, October 17th blog post, quote, "Well, I belong here. I am proud to say that because all of us have the same disease and there is no discrimination amongst us, and merely just that is why I say I belong." As the month went on, Phumeza seemed to be getting better. By mid-November, she was informed that her test results came back negative. Not just this, but with the TB, often when looking at her lung scans, there would be dark clouds that would appear. but these were appearing to clear up again as well. This showed her and the doctors that the new drugs she was taking, so the linezolid and the clofazimine, alongside the other medications, were working. And she was extremely happy to hear this news. In a blog post titled "Finishing Another Year in Hospital/Hospice" from Friday, December 9th, 2011, Phumeza described the difficulties in dealing with this, stating, quote, 2010 and 2011 living with XDR-TB. Now we are going to enter 2012 in a couple of weeks. To me, this is just a horror movie, and it seems like it is not yet ready to end. Just when everything is starting to get better, something will come on the way and there will be setbacks. The question I have in my mind, if drug-resistant TB is surely curable, how come some of us develop things such as pneumothorax and have to go to surgery? After just finishing with that, you found out you were resistant to some more drugs. That just confuses me, really. Phumeza described how during that time in December 2011, it was always sad seeing new patients with drug-resistant TB being admitted into the hospital, especially with it being holiday season. Around that time, the MSF hosted an end-of-the-year function for the drug-resistant TB patients near the pools in Kailicha. They not only played games, presented speeches, and ate food, but the patients were also given certificates for commencing drug-resistant TB treatment. Phumeza stated, quote, "It is so inspirational getting encouragement from those who are helping you to live. No organization that I know of can do something like this for their patients. This is the first. I bow for the team Médecins Sans Frontières. They are doing more than expected by encouraging the patients not to get bored, tired, to eat, drink their medicines because they know the strain of drinking plus or minus 20 tablets, and on top of that, these tablets make you sick day in and day out. No wonder there are so many defaults. Luckily, MSF will not chase you away. They will intervene." To reduce stigma and improve clarity, the term default is now classified as lost to follow up, and it's defined as interruption of TB treatment for 2 or more consecutive months. This is a major barrier of treating drug-resistant TB, reported from programs all around the world. Around the time of this case, the rate for patients stopping treatment in Kailicha was 31%. It is a very difficult treatment plan that is extremely hard on both the body and mind, which is why some patients might just stop taking it. So having encouragement like this from the MSF was really important in making sure the patients didn't give up on the treatment. Not just this, but Phumeza also described going out on Friday, December 16th for South Africa's Day of Reconciliation. She, alongside Dr. Hughes, 2 of her doctor's friends, and 2 patients from the care center went to Kalk Bay, Chapman's Peak, and Hout Bay, which are all beautiful areas with water, beaches, and mountains. Not just this, but Dr. Hughes also took them to a nice restaurant and covered all of their meals. Phumeza described this saying, quote, "It is so nice that once in a while you forget about your problems and the disease you are living with. I guess that is what our doctor had in mind, to get out of the TB care center and enjoy the outside world. I do not know of any doctor who will dedicate him or herself to his or her patients like the one I know. Dr. Jenny, I mean, taking out your patients to have a feast. Wow." For the next few weeks, Phumeza continued on with her treatment. Things seemed to be going right on schedule. She was gaining some weight. She felt so much stronger, and it looked like she was going to be healed in no time. However, on Friday, January 13th, 2012, after doing just fine for those past few months, like before, she was hit with very concerning news. She was approached by her doctor to discuss her latest sputum results. And during this meeting, her doctor informed her that the latest sputum results came back positive. With this, she informed her that at that point, they only had a few options, which Phumeza stated were, quote, "It's either I stop the treatment and simply die, or I continue with the treatment and hope that the sputum will come back again to negative." There was also the possibility of her completing a surgery in which they remove the infected part of her lung and then they continue with treatment to get rid of whatever is left after the surgery. There was just no guarantee that doing this would work. With how things were looking, they actually told her that it's very unlikely for the culture results to be negative again, and that, quote, only a miracle will happen in this case. And with this, the doctor actually approached Phumeza, advising her to consult a priest to prepare her for passing away, because at that point, there was really nothing they could do. All Phumeza was thinking was that she didn't have anything to lose. The only way she could possibly be healed is if she were to go through with whatever the last options were. So she was willing to try anything. When describing her frustration with the situation of getting healthy just for there to be this setback again, she wrote in a January 13th blog post, quote, "To hell with that. I'm going to beat this thing, so I hope, and forget that it even existed. To hell with the TB. Excuse my angriness. I've had enough. If you try to make it nice instead of saying it straight, people easily ignore it. It took my hearing away. Now it wants to take my life. WTF." For the next month, Phumeza continued with the treatment plan the doctors were hoping would work. They didn't complete the surgery as of yet, but they were continuing her on the medications, adjusting the dosage as needed. They couldn't guarantee anything, but they were just really hoping this would do the trick. But just around the last week of February, more results came back, which left everybody worried. They had Phumeza complete a CT scan, and she was absolutely shocked to learn that not only was her right lung infected, but her left lung was infected as well. They had found one infected gland in her right lung and two infected glands in her left lung. And with both lungs now being infected, the idea of doing the surgery was looking to be much more difficult than they initially expected. Initially, the month before, Phumeza was very determined to get through this. But after hearing these results, she was truthfully beginning to lose hope. Not only had the doctors never done anything like this before, but with now both lungs being infected and with her having XDR-TB, this would have been a very difficult task. And if the surgery didn't work, it risked further spreading the infection throughout her lungs. While she was open to completing the surgery, she described that something didn't feel right about doing it. But nonetheless, she was still willing to take her chances and didn't feel rushed to get it done. Her care team with the MSF tried their best to encourage her to keep going forward and not give up, but this was very difficult, with Phumeza writing, quote, "I have had negative thoughts lately, like why bother fighting for something that we all see that it is impossible. Someone said miracles do happen. At that point in time, I was back to my old self. But still, there is that voice that keeps on saying, why bother? Apparently, I am waiting for a huge yet hopeful miracle to happen. I am so patiently waiting for that day." This entire time was a big mental struggle for Phumeza. She mentioned that she felt like she needed to talk to someone, specifically a psychologist, as there were days where she felt she was worthless. There were days that Phumeza considered just not taking her pills, but the support from her family, friends, care team, and fellow patients really helped with helping her not give up on the treatment. And she also reminded herself often that if she didn't take them, she would feel guilty. So this helped convince herself that it wasn't so bad. Her fellow patients even looked up to her in a way for how easy it was to communicate with her or be around her, and also for the fact that she had times where she enjoyed being alone, which was something they didn't understand or relate to. World Tuberculosis Day is held every year on March 24th. So for that year, in 2012, Phumeza created video blogs with the TB&ME website, which were posted online on YouTube on Wednesday, March 21st, 2012. In this video, she gave a tour of the facility.
This is the outside where we sit here and watch television with my mates. Now we're gonna enter inside. This is where I sleep, my bed, my wardrobe. I like to live a lot. These are my books. It's nice here, apart from living in hospitals. Here we all got the same disease. MDR, XDR patients only, mainly TB only.
Here, she talks about improvements needed.
The government must find better medication for the patient, like the Lazard and the clofazimine that we get from the other medications apart from government, because there are more MDR-XDR patients being admitted to hospitals now, and the medication seems to take years for them to get cured. So if they get stronger drugs, maybe then there will be less people who default and be less people dying from.
Here, she talks about redeeming love.
There's a book called Redeeming Love. There's a man there called Michael Hosea who got married with a prostitute, Sarah. Sarah used to run away from him many times, several times, but Michael did not give up hope. He will get on his work and go look out for her in the city. And this similar applies to me because no matter how hard the situation is or how difficult it is, you must just pull yourself up and get what you want. Meaning that I must, whether the tablets make me sick or not, I must take them each and every day so that I could get my life back again, live a normal life, away from her.
And here, she makes a thank you video.
I want to thank you, the readers who read my blog. Someone said there on the blog that I inspired her in a way that she couldn't believe, because her husband was diagnosed with TB and she did not know what to do with him. But after reading my book, she knew what to do. So I would like to thank you. I would like to thank you a lot for giving me hope, courage, and praying from me.
Through the treatment, Phumeza pushed herself to do things that seemed impossible to her. Sometime around May, Phumeza and Dr. Hughes went on a trip to a mountain named Lion's Head in Cape Town. When they got there, Phumeza had zero expectations of being able to climb to the top, especially as she stated she didn't do any kind of exercise. But Dr. Hughes encouraged her, and with occasional help, Phumeza was able to push herself to get to the top of the mountain. From that view, she was able to see the whole of Cape Town, and she described, quote, "I couldn't believe it, that it was me on top. I cannot wait for the day when I would look down on XDR-TB for sure. That is so damn possible. Yes, I can do it." Which was in fact very true, because it was just on Friday, May 11th, 2012, when Phumeza posted a blog titled Climbing Mountains, where she gave an update on how she was doing. And to her and everyone's fortune, the results from her last 2 cultures were negative. After receiving the negative results, those at the care team came up to her and were celebrating because they were so excited to hear these results. And Phumeza was absolutely stunned with these results because of how she'd been doing on the medications. Particularly the linezolid she described was, quote, playing tricks on her. But nonetheless, the treatment ended up working, and she cried tears of joy and excitement because of this. Phumeza had been at Lizo Nabanda for almost 9 months by that point. With these results and with her getting much healthier, gaining weight, and getting stronger, the care team told her that it's looking like she'd be able to get discharged soon. For about 3.5 months since then, Phumeza hadn't blogged, but finally on Wednesday, August 29th, 2012, she posted a blog titled Bad News, Good News. For the bad news, she explained that one of her friends at the TB care center had passed away. She was very close to him at the center, so this was a very sad time for her. Regarding the good news, however, after doing all the treatment in the multiple different hospitals and clinics, it was finally that month in August when she was discharged from the Lizo Nabanda TB Care Center. Those over at the care center hosted a farewell party for both Phumeza following this and for her friend who had passed away. And the local newspaper even was invited to write a story about the patients at the care center. The people in the story included patients who'd spent the longest amount of time at the care center, with the longest being a 12-month stay. And at this farewell party, they made speeches and celebrated with each other. And Phumeza described the moment, stating, quote, "The speeches they made were touching. We were a great family, more like a home away from home." After Phumeza was discharged from the care center, they arranged for her to do treatment outpatient at her local clinic. Now that her cultures were negative, this meant that she didn't need to do the surgery anymore. At some point, Phumeza joined a support group of other TB patients from the care center who were being treated with the linezolid and the clofazimine. And there were 8 members total in this group, and together they would talk about how they're feeling and the side effects they were experiencing from the linezolid, most notably being vomiting. Overall, Phumeza now was feeling much more optimistic, and she was looking forward and hoping the day would soon come where she would finally be healed from TB. That next month, on Wednesday, September 5th, 2012, Phumeza celebrated her 22nd birthday, which was very big for her because she described that there was a time she didn't think she would even get to that point. During that weekend, Dr. Hughes organized a trip down to a farmhouse in a city called Petal in Western Cape. And Phumeza was joined by her mom, the mother of her friend who had passed away, his niece, and also Dr. Hughes's friends. This farmhouse was one in which wine was made, so Phumeza was able to enjoy a glass or two. They brought her presents, and it was a great time. She described, quote, "It was so nice. Clearly they are doctors without borders." During those next few months, Phumeza continued receiving negative sputum culture results to the point she began losing count of how many were negative. She did have a few problems. She was taking the 2 notable medications, linezolid and clofazimine. The linezolid she was receiving from the MSF, but the other medications she was receiving from the government. Around November, she mentioned having a bit of trouble receiving the clofazimine. I'm not sure exactly what the problem was, but nonetheless, even with this, everything was still looking good. So good to the point, people assumed she was done doing treatment, and a friend had even messaged her on Facebook asking her why she hadn't announced being done treatment yet. But she wasn't done, nor had her doctors even discussed finishing treatment anytime soon. Phumeza got into a very good routine with doing the treatment that at some point they decided they would give her all her meds for a week at a time. And whenever she needed to do sputum culture testing or do blood work, the sister who was in charge, so the head nurse, would text Phumeza and let her know to come into the clinic to get this done. And Phumeza described this new routine as being an easy ride. That next month in December, the support group Phumeza was in, alongside 2 inpatients from the TB care center, had an end of the year event by the beach, which she enjoyed. However, reflecting on this time of the year, she described, quote, "Supposed to be a happy new year, right? For me, personally, nothing happy about this year. Maybe it's still too soon to judge it, but I'll have to wait and see. Supposed to be in my 4th year at university right now. Most of my friends are going to be graduates this year, and I'm not even close to that. Guess everything happens for a reason. But for this, I don't see any reason why it has to be so damn hard. But again, I guess it's those lessons that life is not easy, but really, does it have to be this hard? Maybe it will be a happy new year the day they say I'm actually cured from XDR, be it in June, July. For me, that would be a happy new year." Phumeza was entering her 4th year of dealing with TB since being diagnosed in 2010, which was mind-boggling to her considering initially she was under the impression she would be cured from TB in just about 6 months. But then this turned into her being cured from MDR-TB in about 2 years, which still didn't happen. And after over a year of dealing with XDR-TB, she was still just waiting for the moment she would be healed. While dealing with treatment, Phumeza was extremely passionate regarding the disparities in healthcare for people who are diagnosed with drug-resistant TB. Sometime in March of 2013, she, alongside Dr. Hughes and the other XDR-TB patients from the support group at Lizonabanda, sat down together to discuss all of the things that needed attention regarding drug-resistant TB. Most notably, this included the fact that these patients were taking 20+ tablets a day, which made them feel extremely ill. And also, these came with serious side effects, such as losing one's hearing, as Phumeza and other patients had experienced. Not just this, but their treatment plan was also very long, taking about 2 to 3 years. With all of these important issues that needed light, Phumeza, Dr. Hughes, and the patients were like, why don't we raise awareness on this and get this out there to the world? And because of this, they ended up writing a manifesto titled "Test Me, Treat Me, a drug-resistant TB manifesto, which Phumeza stated was to, quote, get a word out there, mainly on the things that we as patients demand from the people responsible for giving treatment to who's affected and infected with TB. This manifesto called for 3 important demands to happen immediately: universal access to drug-resistant TB diagnosis and treatment, better treatment regimens so that effective, more tolerable, shorter, and affordable treatments are delivered by the TB research community, including both research institutes and drug companies, and also financial support to increase drug-resistant TB treatment, and a commitment to support research into developing better treatment. They were hoping that with this manifesto, they would get enough petition signatures and the right people would see it, and they would take effective work on this immediately. And they emphasized, as both patients and healthcare providers, they would commit themselves to, quote, encouraging each other to test for TB, take our treatment, and remain in care, protecting those people close to us from TB transmission, holding our governments accountable, and pushing them to respond to the crisis, and sharing stories to improve TB awareness and reduce stigma in our communities. A few months later, sometime around June 2013, Lizzo Nabanda was visited by South African singer Lyra and Swedish jazz musician Niels Landgren and his band, who created Funk for Life, an initiative which, quote, raises money for MSF through album sales and aims to inspire achievement in children through music. Just like many other people, they too didn't know much about TB, and Lyra was blown away to hear about the treatment and how the patients had the courage to get through it with all of the side effects it came with. Regarding this, in a blog post titled Blown Away from Friday, June 21st, 2013, Phumeza wrote, quote, oh, well, this treatment is like a dare. Either you take it or you don't. Taking it, you risk being deaf permanently. You risk being a psycho too. That's not all. Day in and day out, you vomit, have skin problems, the list goes on. Well, if you don't take it, then it's obvious you'll die in a matter of months. But it can be so unfair to others, whereby they don't respond to treatments, then they also die. While there, Niels Landgren, the Funk for Life crew, and Lyra filmed a music video titled You Got It. This song was dedicated to Phumeza and was made in support of the MSF. This was definitely a plus for her. And what was also a plus is that during that time in June, word on the street was that Phumeza was possibly looking into being finished treatment in 2 months, in August, which definitely was looking to be the case. Since February of 2012, all of her sputum culture results had come back negative, and by the beginning of August, she was approached by her care team to speak about this. Over the past 12 months of treatment, she'd received more than 5 consecutive negative sputum culture test results, and they told her that she was going to be finished with treatment that month. Finally, after 2 years of undergoing a highly intensive strengthened treatment regimen for XDR-TB and having an extremely low survival chance, on Friday, August 16th, 2013, Phumeza took her last tablets, officially finishing treatment for XDR-TB at the Lizzo Nabanda TB Care Center. Of the 22 patients who were also enrolled in the strengthened treatment plan with the linezolid since 2 years prior in July 2011, Phumeza was the first to be cured. They gave her a certificate for completing her treatment and surviving XDR-TB, and she cried tears of joy as they held a celebratory party for her at the care center. This party was joined by patients, doctors, and the staff as a way to not only celebrate Phumeza's completion of the treatment, but to show other patients that XDR-TB is curable, so they could remain hopeful. Very soon after completing this, Phumeza was already thinking about her future plans and ambitions. She hoped to go back to school, to resume her studies at university, and she had goals to continue on with the other dreams she had pre-diagnosis. She wrote, quote, "It is time to go back now and do what I always wanted to do. XDR-TB surely changed me. Now I am looking at life from a different angle, being more careful and wiser than I was before. I will keep encouraging other patients as I used to, so that I can be an example to them." Phumeza did in fact go on to speak out about drug-resistant TB and advocate for changes surrounding the medications for it. On October 30th, 2013 to November 3rd, she went to Paris, France for the Union World Conference on Lung Health. This was her first international experience, and after speaking, she actually received a standing ovation. She then headed to Geneva, Switzerland in May 2014 for the 67th World Health Assembly. And it was there on Wednesday, May 21st, 2014, where she handed the manifesto over to Dr. Mario Raviglione, director of the Global TB Department at the World Health Organization. The manifesto had over 55,000 petition signatures, and after handing over those signatures, the petition was officially closed.
So now there are more than 53,000 people who have signed it.
That's what I heard.
So I'm going to give you these signatures now.
Okay,
right?
Excellent.
I want to say thank you to every one of you who have signed this petition and spread the word. The petition is ended now, but the fight still goes on. Thank you.
In the fall of 2014, Phumeza headed to London to do a radio and TV interview at BBC Studios. Right after that, she headed to Athens, Greece, where she spoke at the Health Forward conference hosted on September 13th and 14th, 2014. And in later years, she headed to New York, United States, for the United Nations high-level meeting on tuberculosis. These are just a few of the many places she's been able to speak at. Overall, her main message to the governments and World Health leaders was to stop putting profits before patients regarding patent laws, because it was through the linezolid, along with other medications, that Phumeza was cured. But due to it being under patent laws, it's not easily accessible as it's too expensive for majority of people to afford. She emphasized that drug-resistant TB is a public health emergency, so patent laws need to be adjusted to make medications more accessible, and funding must be improved so that there can be more research put towards developing proper treatments. As discussed, one of the most notable side effects Phumeza experienced as a result of the treatment was losing her hearing. Now, I'm unsure when, but at some point she had gotten a hearing aid, but she didn't use it because not only was it uncomfortable, but it wasn't that useful. As she described, quote, "I can hear the bang of a door, but with talking, I can't hear it, and it's annoying." The only person she had an easy time lip reading was her mother's, but it was more difficult for her to lip read others. And even when she would tell people she was deaf, they wouldn't believe her because she was able to speak. Without being able to hear, Phumeza stated that it wouldn't be possible for her to go back to school. At first, she did want to see if she could learn to sign, but she eventually described, quote, "I didn't want to learn sign. It was not me. I wasn't born deaf, so I'm not sure if I'm going to adjust to that world. Most of the people who do sign language can't speak right, so I would find it difficult." She did really want to go back to school though, and just overall have her hearing to enjoy things she used to love, like music, dancing, and listening to her loved ones. Initially, she was told by the hospital that there was nothing they could do. However, one day, Phumeza decided to go on Google to see if there might just be one thing. And in doing this, she came across something called Cochlear implants, which are small electronic devices that can help people hear sounds. This sounded very intriguing, so she read up more about it. And sometime in 2014, she headed to Tygerberg Hospital in Cape Town for an appointment to get her ears evaluated. After doing a few tests, to Phumeza's fortune, they informed her that she was a suitable candidate to receive cochlear implants. They sent Phumeza to an ear, nose, and throat, or ENT surgeon, who too told Phumeza that she was a suitable candidate. Following this, they sent her off to get more scans done, including an MRI. And once those came back, they confirmed that they would like to go forward. It was just a matter of figuring out when, which wasn't exactly easy at first. The implant wasn't something that was going to be covered by the MSF, and it was really expensive. The average cost of one implant alone averages between $30,000 to $50,000 USD, but when accounting for the implant, surgery, and rehabilitation, according to an article from the Duke University School of Medicine, the total cost can range anywhere from $50,000 to $100,000 USD. Phumeza's implant was going to cost 500,000 South African Rand, which was approximately $40,000 US dollars. So after seeing the ENT surgeon, Phumeza went on to begin raising money to afford this procedure. She had a fundraiser called Friend of Phumeza, set up through a foundation called Give and Gain. More than 180 people from all around the world donated, and fortunately she was able to successfully raise the funds. With this, finally, the surgery was officially scheduled to take place on Friday, February 20th, 2015 at the Kingsburg Hospital in Cape Town. Phumeza's audiologist told her that with the recovery, this was going to be a long journey. Cochlear implants contain an internal part and an external part. For the surgery, they would place the implant inside of her inner ear. Then, for the first month following the surgery, they would expect for Phumeza to not be able to hear anything. After that month, they would attach an external portion just behind the ears on the outside of her head. And from this, they would then activate the devices using a speech processor programmed through a computer. After this, Phumeza would be expected to hear some sound, just potentially not as clear. But as she would continue to do regular follow-ups to program the devices into oral rehabilitation, so listening training, over a number of weeks, she should be able to eventually adapt and learn how to hear with the cochlear implants. Then, by 3 to 6 months post-op, they expect for her to hear with greater ease. So it was a long journey, but Phumeza was up for the challenge and was ready to get this done. On that February 20th, she had the procedure successfully completed. And a month later, on Friday, March 20th, 2015, she headed to her audiologist to get the device activated. After turning the switch on, her audiologist made small soft sounds, and Phumeza was able to hear this. Then her audiologist began speaking, and for the first time, Phumeza was clearly able to hear her voice. But the moment Phumeza had been waiting for, her mother said something. And finally, after 5 years, she was able to hear her mother's voice again. Phumeza cried tears of joy after this, and it was overall a very emotional moment. She ended up making a post on Facebook at 2:48 p.m. stating, quote, "Miracles do happen every day. Hashtag cochlear implant, hashtag activation, hashtag highly favored." And after posting this, immediately people began making phone calls to her, which at the time wasn't the most perfect sounding. However, a couple months later, on May 31st, she tweeted an update stating that she was finally able to make phone calls. There are many things that can be learned from Phumeza's story. She stated that if she was warned that a risk of the kanamycin injections was that she'd lose her hearing, she most likely wouldn't have agreed to taking them. After using the kanamycin for 4 months and the capreomycin for 3 months, both of these injections were found to be ineffective in Phumeza's treatment. And studies later on showed that these injections overall weren't even really that effective in general. And hearing loss isn't the only side effect that patients have experienced from these treatment plans. Phumeza mentioned meeting other people who have had TB while she was in Paris, and they actually lost their vision from the treatment too. Plus, Phumeza too experienced other side effects as she vomited every day, she had skin rashes, her skin was getting darker, and just many more. Many activists and organizations called for the discontinuation of harmful injections, such as the kanamycin. Through the advocacy of Phumeza, many others, and organizations like the MSF and TB Proof, on June 17, 2018, South Africa became the first country to discontinue the use of these injections to instead use newer and more effective antibiotics. This was soon followed by several organizations at the 49th Union World Conference on Lung Health in October 2018, calling for national TB programs around the world to discontinue the use of these injections. And then finally, in the following year, in 2019, kanamycin and capreomycin were officially removed from the World Health Organization's treatment guideline recommendations for MDR-TB. Phumeza was misdiagnosed twice, first with TB and then with MDR-TB. It was emphasized throughout her story by both Phumeza and Dr. Hughes that had the proper diagnostic tools been available, her correct diagnosis of XDR-TB would have been known from the start, and the disease likely wouldn't have progressed as much as it did because they would have been able to treat it immediately. In 2014, the World Health Assembly adopted the World Health Organization's post-2015 End TB strategy, with the quote, aims to end the global TB epidemic as part of the newly adopted Sustainable Development Goals. And their overall goal is to end the global TB epidemic by 2035, with specific focus on targets for 2020, 2025, 2030, and 2035. Between 2015 and 2023, South Africa was actually one out of more than 10 countries to receive an estimated reduction of at least 50%. This reduction in incidence rates suggested that the 2025 milestone of the End TB strategy had been reached in South Africa. But despite this, in the World Health Organization's 2024 report, they stated, quote, globally, the net reduction in the TB incidence rate from 2015 to 2023 was 8.3%, far from the World Health Organization End TB strategy milestone of a 50% reduction by 2025. This setback in their goals is largely attributed to the disruption of TB services caused by the COVID-19 pandemic, but the efforts are still being made to get this back on track. In a 2022 podcast with the Liverpool School of Tropical Medicine, Phumeza brings up the comparison of COVID being acted on so quickly and emphasized that that same energy needs to be acted on for TB. She mentioned that for tuberculosis, there's only one vaccine that exists, and this vaccine was created over 100 years ago, being used on the first human in 1921. Since then, there's been no new ones that have been made. With this, she brings up the point that policymakers only make changes when it's beneficial to them. So that's why TB might be overlooked because it's not affecting them like how COVID was. She also stated that till this day, there's still a lack of education regarding TB, and there's a lot of stigma associated with it, which she even stated prevents people from going into their local clinic to seek treatment because they don't want to feel shame. Before being diagnosed with TB, Phumeza was in school with the intentions of someday working in business. But after everything that has happened, she did in fact go back to school, but this time with an interest in the health field. In 2017, she was finally able to head back to university at the University of Cape Town. And in 2019, she officially graduated with a bachelor's degree in social science. Today, she works as an advocacy officer, research assistant, and project lead at an organization called TB Proof. Through her work, she continues to advocate for improvements in the treatment and psychosocial outcome for patients with drug-resistant tuberculosis. She mentioned heading to tbproof.org to read up on more stories about patients and survivors of tuberculosis. The link will be in the description. Phumeza, reflecting on the situation, stated, quote, the XDR-TB hit me so hard there was no hope at all. I'd heard about TB, but never in a million years did it occur to me that I would be a patient from it. I thought it only happens to certain people who are also suffering from other diseases, but here I am today sharing my story with people all around the world. Really, who would have thought it? But yes, that is it for this video. What are your thoughts on Phumeza's story? Did you know or do you know much about tuberculosis and drug-resistant tuberculosis? Please comment your thoughts below and don't forget to subscribe so you don't miss any other videos on medical cases, crime, and mysteries. Bye now.